Angela Ryan, who is a registered nurse and a Fellow of the College of Nursing and a Churchill Fellow and a graduate of the Australian Institute of Company Directors, amongst many other things. Angela's going to talk about rebooting the health system and how nurses are powering the digital future of health. Please join me in welcoming Angela Ryan.
Thanks, Karen. Oh, wow. I think there's over-mic'd there. A bit of a tough act to follow this morning, and I'm talking about you, Karen. Excellent to hear from the Minister, and congratulations to all the trailblazers, and it provides a perfect segue to what I'll be talking about today. So thank you for the invitation to speak. And I'm still a registered nurse. I hold my identity as a nurse very proudly, and it continues to inform the way I think about and advocate for us more broadly. So my focus today is really about the power that you have to influence in regard to innovation, and I really want to centre that and give rise to the way we think about innovation. Oh, wrong slide. And look, before I start, I'd like to acknowledge the Ngunnawal people as the traditional custodians of the lands that we are meeting on today, and pay my respects to elders past and present. It's a privilege to walk alongside Aboriginal and Torres Strait Islander peoples in this country, our first innovators, our first scientists, our first caregivers. I'd also make you aware that today I will be acknowledging Aboriginal and Torres Strait Islander leaders in my presentation, and that people in the audience be advised that one of these leaders has passed. So the information being provided is in the public domain, and I use and with respect to family and community. We like to call this our welcome slide from legal. It's essentially a little bit of a disclaimer there, but because I'll be referencing product very briefly, I need to keep it there. Look, some of you may have seen me show this previously, and I really like to use it, and it'll become quite apparent soon. It's a painting by Hieronymus Bosch, 1494, and it's actually a depiction of the oldest known surgical procedure, the craniotomy, or the trepanation as it was known then, the practice of drilling a hole in the skull to relieve pressure, treat disease, and in this case, provide an escape hatch for evil spirits. So we see the surgeon there, and we know it's a surgeon because he's wearing a funny hat. We know that the patient, self-evident, sadly awake and looking somewhat distressed. We see the priest or anaesthetist ministering holy water and a few Hail Marys. And clearly the wisest person in the room, which you would all agree, is the nurse looking on with apparent disdain, most likely because she already knows just how this is going to go. So look, I use this really just to demonstrate that not just how far we've come, but in the business of healthcare, or the practice of healthcare, we always aim to build upon what's gone before and take good ideas and develop them and improve them and innovate. So look, this was a good day, my graduation. I was one of the last to go through hospital training back in the Royal Brisbane in the late 80s, and you can place me there with my hairdo and my outfit, and look, not much has changed. But I guess my expectations were high, but digital was really a thought bubble at that time, and I had no idea I'd end up here. And shout out to Veronica Casey, who helped me along the way there. This is me fast forwarding to the early 2000s. This is me living my best life in the server room of the RPA Intensive Care Service. I haven't changed a bit. In the latest version of the ACN's Hive magazine, Alison McMillan tells us that demographers predict most young people today will have at least 6 careers in their working life. So nursing can offer that unique opportunity to experience those 6 careers within one profession. And she has demonstrated that clearly, capably and proudly. So I'm also living proof that you really will have no idea where you will end up. And just to reassure you, this isn't going to be a dance of me through the decades. That's the last picture you'll see of me. So look, I guess it's remarkable to me that we still need to be justifying the imperative. We talk a lot about the need for transformation, and the word urgency is everywhere. But how often can we say that the health system's in crisis without wondering at what point it's going to be unrecoverable? And it was the Professor Enrico Cuera who said in 2019, digital health, the decade-long journey we've been on for 50 years. So we've been at this a while. We knew that the pandemic was a watershed, sped things up, but we couldn't sustain the pace. And that need, though, has not gone away, and in fact it's greater. So we are really central to this shift. We are everywhere in the health system, and we're everywhere across the continuum. So I really want you to be thinking about your place here and think about how we might actually foster innovation, no matter where we sit on that spectrum, and that is a really key point. So to future-proof the health system and deal with this crisis, we need to be prepared, to be resilient, to be adaptable, and we hear those words a lot. But it has to be, our goal has to be that we can not only withstand change, but also thrive in it. So delivering high quality, equitable, culturally safe, clinically led and sustainable care well into the future. And that's something which our new ICN definition really powerfully articulates. So in thinking about the future, it's important just to have a quick zip back to the past and where we've come from. This is Ellen Doherty, you might know, New Zealander, the very first registered nurse in 1901. New Zealand was the first country to recognise the profession. And it was the first legal acknowledgement anyway, so not only were they trailblazing on the right for women to vote front, but also for us as nurses too. These women, known as the Black Angels in New York City, they played a pivotal role in the development and treatment of TB in the 1950s. And they proudly stood up when others wouldn't, and at great personal risk despite the discrimination that they faced in the process. This is the first crash cart. You probably know this. This is Anita Dorr, who designed it as a crisis cart with her husband in their garage. They created the prototype after becoming really frustrated about being able to access supplies for critical patients. This is Auntie Dulcie Flower. She is a trained midwife. She was instrumental in setting up Aboriginal medical services in the 1970s. Creating spaces where Indigenous peoples can exercise greater self-determination in their own healthcare, and she was awarded the Lifetime Achievement NAIDOC last year. This is Auntie Pamela Mam, and now passed with respect, who was a pioneer in nursing, one of Queensland's first Aboriginal nurses, and a trailblazer too for First Nations health services. So during her lifetime, she was an inspirational figure who created an ongoing legacy of compassion and commitment for the health and care of First Nations across Queensland. And let's not forget nursing contribution to the AIDS crisis, providing compassion and leadership during a time of great and profound adversity. So look, let's come back to the present day, and it's a really different kind of ecosystem, as you're well aware, and it's resplendent really with all kinds of evolving and emerging opportunity. So we have AI in diagnostics, we have remote patient monitoring, we have AI in wound care, and shout out to Michelle, our new trailblazer, and we have hospital in the home, and we also have AI in nurse triage. And look, the list goes on, and we are front and centre. We are everywhere in this. So I guess in thinking about that ecosystem, I sort of want to consider it from the perspective of where we sit, so hence the segmentation and how, again, we can influence and drive innovation. So we've all been nursing students, we've been nurses in practice, many of us have also been educators and policy leaders, but not many of us, I don't think, would define ourselves naturally as innovators. So we've all been part of something new, a change, big or small, but it doesn't actually have to be about designing new tech or being part of a startup, although that's part of it, and in thinking about that influence and how you can shape. So nurses care, we lead, we educate, we research, we shape policy to improve health outcomes. So no matter where you are, I want you to be thinking about it as I walk through these segments, that power that you have in that voice. So I'll start with the nurses in practice. We're the ones who understand our workflows best and how tools need to be designed to work in concert. And we know we've had some challenges over the years. So there's a plethora of AI scribes out there, and we know this, but they've rarely been designed with nurses in mind. This tool is being developed in concert with nurses, and I'm looking at you, Naomi, wherever you are. So for nursing workflows, really acknowledging our specific requirements and not just sort of cut down doctor tools. So for patient-facing nurses, this is really your opportunity to influence. So this is a product that we are in the process of developing, but that really should be a signal for the way you interact with all of the people who you work with across the system and how you embed yourselves at the beginning of that cycle and inform that design. So we really need to be continuing to push for that close engagement. And I guess building on that, this is the next generation EMR. And I think applying those same principles more broadly, it's also being designed with nurses and by nurses. So it is quite a step change. And I think we would all agree that many of the tools that have been designed in our own EMRs are part of that, have contributed to those challenges around documentation burden, among many other things. So this again is another opportunity to contribute to something entirely novel. And again, I would really encourage you, where there's an opportunity, that you are front and centre and you keep that in mind. And look, these tools are being designed with robust governance and safety in mind, and we'll be working closely with our colleagues in health services to do that. But it's really a fundamental principle around that is recognising the power of our voices. So we've seen some prototype creators already this morning, and I wanted to have a brief touch on that. It's not uncommon now, where it may have been previously, to hear about nurses as founders and CEOs of their own companies. So the people I highlight here will be known to you, most likely, but unfortunately I didn't have time. It's a random selection of a few. So the first up is Zara Lord, who many of you will know, CEO and founder of UPage. So that's really been about giving healthcare workers freedom of choice over the way the way we work and control over careers on a platform that services not just them with their skills and capabilities, but also with the organisations that they work with. This is Dr. Nathan Moore. He actually recently commercialised his PhD research and founded Frameless Interactive. So through this startup, he and his team explore the design, development and delivery of highly immersive AI and VR-enabled simulation for training and education. I really encourage you to look into this. It's really quite something else. Sonia, I don't believe needs any introduction, a former Trailblazer winner and also fellow Churchill Fellow, founding OneBridge, providing outreach healthcare that is nurse-led, nurse-driven for individuals experiencing homelessness and poverty. And finally, I'd just really like to congratulate all of the Trailblazer finalists. I obviously didn't have any intel, so I couldn't have a single photo, but everyone is richly and highly deserved finalists, and congratulations to Michelle again. So look, thinking about nurses as educators, and for me this is probably almost the most important part of a nursing journey. So you're the ones who are fostering knowledge and critical thinking as a foundation for a nurse's pathway into our role as caregivers first, but also then creating the seed for the many different directions that the profession offers. So beyond the fundamental tenets of who we are as nurses, this is where you're able to manifest the concepts of innovation and identity and really embedding design thinking and informatics at the outset. I came across some research by Wong et al. In 2024, was looking at nursing students' perceptions of digital health technology on the future of nursing and really looking specifically at how technology might impact the fundamental identity of nurses and the ongoing need to keep humanness at its core. And we know this to be critical. And so researchers concluded that educators should prepare students to redefine their nursing identity by exploring how that technology augments their practice and critical thinking skills. And I'll come to that in a little bit, while addressing sort of fear of a perceived threat to the future of nursing. So preparedness to be an educated nurse in this context is much more than the competency. It's central to identity. So it's my belief as educators that you are actually the most important valuable asset in fostering that innovation mindset and many other things right from the outset. So we've already heard a lot from policy leaders over the last day or so, and we know that there is a great deal of reform, and good to hear again the commitments from the Minister this morning. But we are going to need some innovating thinking, not just in how we design those reforms, but then how they translate in practice. So there's been much published globally, and again, we touched on that yesterday, about those policy priorities, not just by the WHO, but by the ICN. And those priorities are really reflected very much in the guidance documents and policy reforms that are underway here. So we really need to be continuing to advocate and deliver against those priorities, as the system level transformation is really what enables that local transformation, and we understand that to be true. So without that nexus, we'll never really have the kind of system we've all been wanting and working so hard to realise. So a bit of a shout out to the ACN faculty of informatics, nursing informatics. Speaking about policy leaders, there's already been great advice and policy guidance provided by the faculty, and I'd also like to shout out to the brilliant Kerry. I don't know where you are for letting me lean on this slide, but it gives you an indication of the impact and the volume of work that's being produced by the faculty, and I think, impacting nursing more broadly. So I acknowledge all members of the faculty, of course, for this work, but the latest position paper, which you may have seen, is around AI, and it really rightly calls out that nursing informatics must be integral to all aspects of AI application, and that we must play a central role in the design, implementation and evaluation of AI applications, ensuring that ethical and practical considerations are key. Something we don't hear enough about is an emphasis on data. We heard yesterday Alison and Veronica both refer to the liberation of some of the data through the new portal for workforce analysis. So I think what we really need to be doing is using the data we can already get our hands on. Admittedly, I know that can be challenging, but without that data, how do we best inform and guide and reform? So I think this is really fundamental and needs much greater emphasis in my view. I can't think of anything more urgent, actually. So last but not least, those of us just starting out, innovation really starts with curiosity and courage. So I attended a summit recently, and I'd encourage you all to look this study up. It's a global study. It's about trust in AI broadly, not just health, but it contemplates health. But there are some really fascinating insights. And in the last minute or so, I'll just touch on that. And this dovetails with a reference to students, but what really stood out for me, obviously, is that this student generation will not surprisingly be the most AI literate of any generation, and we know this, it's not surprising. But when you dig deeper into the findings, there are some points, I think, to really take note of and think about the opportunity. So students are regularly using AI, and I would argue we most likely all are, so it's not a criticism, whether we choose to say that or not. But instead of working with their cohorts in groups, they're using the tool to ask questions instead. So the first point is that change in collaboration, so working more in isolation. So that's an important one. The second is that students are asking questions of the AI tools that they may have taken the time to learn themselves. So it's really that impact on critical thinking that I think is a concern. So I say this not to alarm, but I think these are things that we need to be mindful about. But for students more broadly, there's an opportunity to really think about how you can use these tools differently. There's some really good research being published around that, but you might reframe the context then and think about how those tools can actually support the way you're learning and not just be a replacement for it. So look, with all of that in mind, I think, what is our vision for the future and what are we going to build together? For me, it's a system that really embraces equity and access. It's culturally safe and trusted. It's underpinned by technology where it's appropriate to do so. And that we as nurses are informing and influencing those designs to meet our collective needs. So that, again, really dovetails with the ICN's new definition. So I really want you to come away from the conference and make a commitment to yourself that no matter who you are and what you do, so regardless of that role you have now or into the future, you have the voice, you have the power to be influencing around innovation. And the future health system is being made now for us, by us. So this is really a call to action to engage innovation wherever you are. So collaborate across roles and disciplines, speak up, prototype, lead. You really do have that voice. And look, I will leave you with a couple of thoughts from the indomitable Jacinda Ardern, who knows a thing or two about the power of voice, showing up and caring. Thank you. Oops, 23 seconds.
Angela, you are awesome. Look at that. She's in the red zone and she's still got 16 seconds up her sleeve. No,
A couple
sit
of
down.
other thoughts, yeah.